Good morning, OLE Health. I'm here to give you an update on the COVID-19 virus and all the work that's been happening to respond as an organization. Thank you so much. We had so many staff members from our Incident Command Center as well as others who put in a lot of hours this weekend to put in some very necessary changes and new workflows. I think one of the first things that you'll notice is we now have front door screening happening at every site to ensure that patients that are symptomatic are not coming into our waiting rooms or into our health centers. Another thing that has changed is we have increased the sanitation of all of our sites. Thank you to the facilities team for making that happen. So you should notice more cleaning going on. Our top priority is the health and safety of our patients and of our staff members. And so we are also looking at ways that we can follow the public health guidelines that are coming out around social distancing and encouraging remote work. There's a couple things happening in those areas today. The first is that we'll be looking at people that can function easily from home and asking them to do so. They have the technological capability and they're able to just go ahead and do that. The second phase will be staff that can also perform work functions from home, but they might need additional equipment. They might need more IT support. So we have limited bandwidth. We're working as quickly as we can, and Gary will be working with teams and supervisors directly on those other job areas. For our operations teams and people involved in direct patient care, we do need you to continue to come in to care for our patients who need us. Something else that's happening is we're engaging our nursing team differently. They will be having a meeting today to help flesh out triage and how that will happen a little bit more robustly, both at the call center and individually at the sites and the front door screening. And finally, we're looking at our patient schedules. That's both for our dental patients and other teams and medical visits. I have our Chief Medical Officer and Chief Dental Officer who will say a bit more about how they're prioritizing patients and schedules and trying to minimize risk to patients and staff. Thank you.
Good morning, OLE Health. It's Dr. Teresa Schinder. I'm the Chief Medical Officer, and I just want to help address some of the questions that are coming through. I appreciate that all of you guys are being inundated with information from social media, from the news, friends, family, fellow colleagues, and so I just want to help address some of those questions. I'll be sending regular updates as well. Providers, first of all, you're going to notice that you have a 30-minute block in your schedules. It's going to be every morning starting tomorrow morning for the next 2 weeks. I want you to use this time to please assess your schedule and go through and prioritize the patients who are essential, have essential visits, and those who do not have essential visits. I'm going to leave some of this criteria up to you as you know your patients the best. Each service line is being assessed separately, and we're looking at each area and determining the essential nature of those visits. And I appreciate that this goes against our open arm welcoming of all patients and being here as a community catch-all. However, right now at this time, we need to follow all the public health policies and ensure that we're keeping our staff and our patients the safest that we can.
Good morning, OLE. Vince Villanova here, just to give you an update on our dental protocol for the next couple of weeks. We will also be using the public health strategies that have been developed by the CDC and also the state of California to prioritize what dental visits that we will be seeing. So for the next 2 weeks, we will be canceling some visits. We will cancel all the non-urgent appointments for our patients that are 65 and older. If there's denture patients, we will be reviewing them case by case. And we would also call the patients to discuss their comfort level on coming in. We will cancel all our initial examination, periodic exams, all period maintenances, sealants, and prophylaxis dental cleanings. We will be reviewing all of our restorative appointments with all of our providers. We will be canceling out this afternoon's restorative and all of tomorrow's restorative, and then we'll review case by case. With the ever-changing nature of COVID-19 and all the strategies with us, we will be sending updates to all of our dental teams and also through the updates that will come through by Jennifer, Dr. Schinder, and Alicia. Thank you for everything you do.
Thank you, Dr. Schinder and Dr. Villanova. Hope that gives you more clarity on what's happening today in the next several hours and this afternoon. One more area I wanted to mention that's come up with several questions is telehealth and telephonic visits for our patients who may be at risk. That is something that's being assessed and we'll hope to have into place in the next several days as well. So more to come. Thank you.